Triglycerides are clearly related to vascular risk, and we know this from genetic studies, what we call Mendelian randomization. In the last few years, we've had important genetic studies. These have been both genome-wide association studies and candidate gene studies. It is now very clear that the genetic variants that predict plasma triglycerides clearly predict the risk of coronary artery disease. And this was perhaps a little bit of a surprise. There was a day when we thought that, well, triglycerides relate to risk, but this is due to the relationship to HDL or some other supposed risk factor. But I think with the genetic data, it is very clear that triglycerides are clearly related to heart disease risk. So the question there is, are triglycerides a risk factor for coronary disease, or is it something else that's carried in the triglyceride-rich particle? And we actually think it's the cholesterol component of triglycerides in the plasma that really are related to risk. We do not believe, for the most part, that it's actually the triglyceride moiety of the triglyceride-rich particle that is the risk factor. Atherosclerosis is essentially due to accumulation of cholesterol in the artery wall in the subendothelial space. And the triglyceride-rich particles are larger. They're not like LDL. They are not taken up by macrophages in the subendothelial space by the LDL receptor. Rather, they're taken up by scavenger receptors. They're taken up readily, and they accumulate there. They do not efflux from the subendothelial space. So there are individuals who believe that triglyceride-rich remnants may actually be more atherogenic than LDL per se.